Alberta Health Services. Healthy Albertans, healthy communities, together.
Innisfail is a leader of dementia care in rural Alberta. Many people who are diagnosed with dementia and their care partners can find the programs they need right in town. That's because local organizations are working together to build a community that supports the aging population. They collaborate with the Alberta-wide Primary Health Care Integrated Geriatric Services Initiative, also called PHC. Ernest Marr attends Alberta Health Services' twice-weekly fall prevention program at Centrepoint Church. His care partner and wife, Nina, often goes to the dementia support group across the hall. Ernest was diagnosed with dementia when he was 75. Nina had noticed that Ernest had begun driving erratically. The diagnosis confirmed what she already suspected. Knowing presented its own challenges.
When he first found out about the diagnosis, it was we were actually feeling very alone. There didn't seem to be anyone to go to talk to or to share or to get information from. We were only offered information in pamphlet form or the ability to go to Red Deer and meet with the Alzheimer's Society there.
Then the Dementia Initiative in Innisfail rolled out. Family Community Support Services began an art program for people in the early stages of dementia and their care partners. Nina and Ernest enrolled.
So it was a very, very good experience for almost 2 years for him. It is very important for Ernest to attend the programs in Innisfail because it helps him to remember the people that he's with and to recognize them and to remember their names. It is very helpful to have programs here in town. It is allowing my partner to have a worthwhile activity while I have some freedom to go and do my own thing. Really and truly, I don't know what I would do without the programs. Innisfail does a great job of looking after its seniors.
Of the 8,000 residents in Innisfail, 39% are over 55 years old. That's 1/3 higher than the provincial average. Town Council recently voted to support a dementia-friendly community in Innisfail. Jean Barkley is a town councillor. She's on the committee driving the Dementia Initiative.
In a rural community, we don't necessarily have the programming that they would in a city, and the more supports we can bring into our community, the greater opportunity we have to keep people here and have them age in the community, and they don't have to leave.
Among the champions of a dementia-friendly Innisfail is Wendy Evans. She's a geriatric assessment nurse at the Wolf Creek Primary Care Network. Wendy first saw Ernest in early 2018.
I had a referral to assess Ernest to do a comprehensive geriatric assessment, and during that assessment we noticed that he had an underlying cognitive impairment. Well, I asked him to follow up with his GP, who confirmed the diagnosis.
Wendy remembers the couple were keen to take advantage of whatever resources they could.
Well, prior to our involvement with PHC a few years ago, none of these programs would have existed. So Nina and Ernest would have had to go to different communities, for instance, Red Deer. Well, I think that we've been very lucky with the collaboration within the town of Innisfail itself, because we're developing further programs to try and meet the needs of these individuals, such as Ernest and Nina, so that they can continue living with dignity within their own community.
Community partnerships, supported by PHC, make it possible for older people like Ernest and Nina to live in their rural community longer with the services they need.
Together, we do amazing things every day.